This is the Obers Test. The Obers Test is used to test the contraction of the TFL and the ITB through the hip region. This test we're able to pick up whether the ITB or TFL possibly may be at a high level of hypertonicity, or we may also find some laxity which is occurring there. So this test is really great to be able to decide what the biomechanics is occurring through the hip region. So what you want to do is have your client sidelined, have their hip stacked, knee stacked, and also ankle stacked. What you want to do is pick up your client's leg for them. Make sure we're grabbing nicely underneath the knees so they're actually feeling supported, and then also grabbing on the other side on their ankle. Once you actually do have them in this portion, having the ankle locked into the hip if you struggle to hold, or if you are like myself and a little bit tinier, just actually have their ankle locked into there. And what you want to then do is slowly release the weight out of their knee and to remove your hand. At this portion, if the leg stays quite high, like we do have here, we're finding that there's probably a high level of hypertonicity through the TFL and the ITB. If you can then actually bring the leg out and allow it to drop. So you want to make sure that your client is fully relaxed in this position. If the knee completely drops and touches the table, we're finding that's a fairly high level of laxity through the ITB and probably what we're after. If you're finding that as you drop the weight out of the knee and you're still holding the ankle and essentially the leg holds itself in that position, we're looking at more hypertonicity through the ITB and the TFL. A positive result through this is essentially that knee not dropping down to the table and keeping in an upright position as we release the weight through the knee region.